It's Wellness Wednesday, a time when we focus on health issues affecting our community. And one of those health issues, Alzheimer's. It is the most common type of dementia. And here are some alarming statistics that you should know. It is among the top leading cause of death in the country, and it's a top 10. Can you believe that? And get this, nearly 14 million people are projected to be living with Alzheimer's by 2060. That's why we have Dr. Jackson Browning with Internal Medicine and Pediatric Clinic with us. He is a primary care physician. You are on the front lines. You are the first point of contact when someone comes to the clinic and they're concerned about, hey, something's not right with me. What are some of the things that you're seeing at IMPC?
Yes, Tanya. So some of the first symptoms and signs that occasionally come up as far as like a major cognitive disease like Alzheimer's include memory loss, which is an obvious one a lot of people think about. Also changes in judgment, personality, the inability to manage previous things that you were able to do, like handling money, paying bills, taking care of your medications, difficulty completing familiar tasks. Maybe you get lost more often while driving, or you need help with things that you used to be able to do on your own. So a big change in those activities of daily living, and that's what really separates Alzheimer's from milder forms of dementia.
So when they come into IM and PC, what is it that you do to be able to help, for one, ease their fear, but to get them to that next stage?
Sure. So one of the most important things, I think, is if you're having concerns of you or a loved one having memory problems, or you're worried about a diagnosis of Alzheimer's, bring it up to your physician. Things that we can do in the clinic include scheduling a good time slot to discuss these. This is not something that can be, diagnosed in 5 minutes. It takes time, but bringing all your medications, giving us your background history, family health history, any family members who have Alzheimer's is very important, and just a good general neurological and physical exam. In addition to that, some of the big things that we would start with.
Mm-hmm. And it's always good for people to reach out to their primary care physician, especially if they're not certain. Do you think sometimes it could be involving like a medication reaction or something like that?
So absolutely. So there's many things that could mimic Alzheimer's, and not everyone with memory loss has Alzheimer's. It is the most common type of dementia, but medications, underlying health conditions, even things like depression can mimic Alzheimer's and cause memory loss, and that's a very important thing to try and tweet out among your physician. Alcohol use, other substances, and many medical conditions in general can mimic that thing. So that's why it's important to have those discussions with your physician and kind of get a comprehensive exam that may include lab work and also imaging of the brain as well.
Wow, thank you so much there, Dr. Jackson Browning, for all of that wonderful information. I think the one that really stuck out for me was depression can mimic Alzheimer's.
Absolutely. So, and that's a very, very common thing that can probably mimic some of the symptoms of Alzheimer's. It may include cognitive slowing and then forgetfulness. So very important to diagnose that and treat it to, not make the incorrect diagnosis.
All right. Well, thank you so much,
Okay.
Dr. Browning,
Thank you
for joining us this afternoon. Well, the